Welcome to Module 2 of the ANDVSA Statewide Primary Prevention Orientation. In this session, we will discuss prevention and the many concepts that inform prevention work. We will look at the rationale behind primary prevention and some of the tools and supports for primary prevention in Alaska and nationally. In this module, we will define what prevention is, going into the 3 different levels of prevention. Then, we will delve a little deeper into primary prevention and talk about why it's so important. Later, we will talk about the challenges that we face when we implement or sustain primary prevention strategies. And finally, we will go over the history of primary prevention in the nation as well as in the state of Alaska. Primary prevention is concerned with stopping something before it ever occurs and is sometimes thought of as the promotion of protective factors. You are probably familiar with prevention on some level already. For example, we know that hand washing can prevent the spread of illness, that wearing a helmet while riding a bike can prevent head injuries in the event of an accident, and that brushing and flossing your teeth can prevent cavities. In this module, we will talk about what prevention looks like with regards to domestic violence, sexual assault, and teen dating violence. Prevention is often discussed across 3 levels: primary, secondary, and tertiary. We use this image of a rope to show how the 3 cords are strongest when it is well integrated and that there are clear linkages between. But we pull them apart so that we can understand them better. In public health, you will often see the levels of prevention represented in this inverted triangle. This is to suggest that if we are fully investing into primary prevention, then we would have fewer individuals requiring early intervention. And if we were able to invest in early intervention, then there would be even fewer individuals that would require response and tertiary prevention. In modern times, we are not able to work within this model, and we anticipate that even if we were able to invest heavily into primary prevention, it would take another generation or so before we would be able to transition into this model. To better understand primary prevention, it is helpful to first understand secondary and tertiary prevention. Let's start with tertiary prevention. Tertiary prevention occurs after violence has occurred. It is the important work of supporting victims of domestic and sexual violence. These strategies respond to violence in the legal system, in the shelter setting, and may work on the long-term consequences of violence such as post-traumatic stress disorder, eating and sleeping disorders, flashbacks, and other physical and psychological problems. Tertiary prevention includes services such as safety planning, counseling, bystander and batterers intervention, and legal advocacy. Tertiary prevention can also include system changes to improve response services and opportunities for victims of violence. Tertiary prevention may also include accountability and policy changes that impact how communities address violence. Secondary prevention is early intervention that comes into play once one has experienced violence in order to deal with the immediate short-term consequences. This might be intervening with a first-time victim, intervening as a bystander, helping individuals to identify violence early, or involving neighborhoods or communities to keep watch over each other. Those who respond to cases of teen dating violence, domestic violence, and sexual assault engaging in secondary prevention include police officers who may defuse the situation or make arrests, shelters who take in displaced women and children, teachers in the school setting, or social workers who work with survivors through all the events that happen in the aftermath of violence. Let's tie all 3 levels of prevention together with a story.
One day, a fisherman was fishing from a riverbank when he saw a child being carried by the current, struggling to keep their head above water. The fisherman jumped in, grabbed the child, and helped them to shore. Upon being rescued, the child thanked the fisherman and left. The fisherman then dried himself off and returned to fishing. Soon after, he heard another cry for help and saw another child being swept downstream. He put down his pole and jumped into the river again and saved the second child. This scenario continued all afternoon. As soon as the fisherman returned to fishing, he would hear another cry for help and would wade in to rescue another drowning child. Finally, the fisherman said to himself, I'd better go upstream and find out what is happening.
We can think of secondary and tertiary prevention as those already in the river. When we think about primary prevention, we want to go upstream and work to understand why these individuals are in the river and how we can assure that they never fall into the river in the first place. We look at the factors, conditions, and systems to address the problem at its source. Next, let's talk about why we should turn our attention to primary prevention. We all deserve to be able to reach our full potential and reach the highest standard of health and safety. There is an obligation to ensure that this generation, and most certainly the next, is able to experience healthy relationships and a safe and supported environment. In order to achieve this, we know that we must also work upstream, and that we will need to ensure that we are working on primary prevention alongside secondary and tertiary prevention. Historically, the DVSA movement was born out of social justice, and much of the movement prioritized the immediate safety needs of women and children, that is, secondary and tertiary prevention. As you may recall from the statistics presented in Module 1 regarding domestic and sexual violence in Alaska, there is such an immediate need for those services, and there is still very limited resources to support the ongoing advocacy and safety needs for individuals in Alaska. Primary prevention of domestic and sexual violence is still fairly young in comparison. But in other fields, however, primary prevention has been in use for quite some time. In the wake of successes of HIV prevention, obesity prevention, and anti-tobacco campaigns, primary prevention of violence has been gaining momentum in recent years. So why is primary prevention an important component for ending domestic, teen dating, and sexual violence? There are several compelling reasons why more and more organizations are engaging with primary prevention. First and most importantly, primary prevention works to ensure that violence stops in the next generation by preventing first-time perpetration in this generation. Violent perpetration is rarely the result of a biological condition, such as being male or having high testosterone levels. As stated in Module 1, it is often seen as part of a larger pattern of power and control. Many risk factors, or protective factors, are found to be present with individuals demonstrating violent perpetration or extreme controlling behavior. It is also thought that they have fewer protective factors. The World Health Organization and the Centers for Disease Control and Prevention have researched these factors, which we will discuss further in Module 3. In prevention, we work to build protective factors, reduce risk factors, and create system change to end violence. We will talk more about the science and innovation of this in the next several modules, but to many of our partners, decision makers, and others, the question remains, why primary prevention? In prevention, we focus on systems, communities, influencers, and individual change, but ultimately, we focus on reducing perpetration of violence because it is clear that if we end perpetration, we will end victimization. It is significant to note that when we break the cycle of violence, we also have an impact on the number of other health indicators that can result from victimization and perpetration, including depression, substance abuse, self-harm, unwanted pregnancies, mental health, and other chronic health issues. Overall, by ending violence, we also can help improve social, mental, and physical health of individuals and communities, leading to a better quality of life. Victim services and batterers programs have tremendous financial and social costs in Alaska and nationally. In 1995, the Center for Disease Control found that the cost of intimate partner violence, factoring in medical treatment, mental health services, and lost productivity at the victim's workplace, was estimated at about $5.8 billion. Adjusted for 2012, the cost totals over $8.7 billion. By employing primary prevention techniques, we can recover some of those costs, making it a cost-effective approach to reducing violence. Also, when we promote a universal culture of peace, respect, and equality, individuals and communities are able to more fully participate and contribute to the success of their own lives, their families, and to the state of Alaska. For those of us committed to working on prevention, we do find that there are several challenges that stand in the way of incorporating primary prevention into our organizations, communities, and work. As great as primary prevention sounds, it can be hard to get started or sustain prevention efforts. For example, prevention and promotion efforts require a high level of resources, whether this means trained staff, volunteers, money, or other resources. Many organizations need all of those resources to make sure that the immediate needs of the victims are being met, including shelter space, staff and advocates, and operations and facility needs. Conceptually, organizations understand the value of primary prevention, but as they look at the current needs of their communities, primary prevention can seem hard to focus on while prioritizing victim safety. Reporting on the impact of primary prevention of domestic violence, sexual assault, and teen dating violence can prove challenging as well. While companion fields such as substance abuse or HIV prevention have a more established body of research to underscore evidence-based strategies and approaches, the research-based and promising documented approaches for teen dating, sexual, and domestic violence is young and has few longitudinal studies that demonstrate long-term success. There is some prevention research on factors that influence the prevalence of sexual assault and domestic violence. There are a few evidence-based school strategies, and there is some promise in the research on some engagement or bystander approaches. A handful of states, including Alaska, that have received federal funding for prevention programs are leading the way in compiling both anecdotal and more comprehensive data on effective approaches to primary prevention. As we delve into prevention, we will see that we can build on effective prevention principles, sound prevention concepts, community traditions, and promise shown from a variety of fields to develop a sound approach to prevention. Each of us will have to determine how to best address these challenges in a way that makes sense for our own communities and organizations. Learning from HIV prevention, obesity prevention, and seeing the promise of DVSA prevention, there was a growing movement of organizations, individuals, and communities committed to primary prevention in Alaska. Building prevention capacity and developing effective programs take time, persistence, and dedication. Both nationally and in Alaska, this has been a journey. Now that you have a basic understanding of primary prevention, let's talk about how it came into being and what is being done today nationally and in Alaska. The idea of preventing violence first came on the scene in 1979 when the U.S. Surgeon General's report indicated that violence was one of 15 priority areas for improving health in the United States. But before any prevention work could be done, violence in the U.S. had to be researched to understand the underlying causes. Throughout the 1980s, the Center for Disease Control, or CDC, began collecting and analyzing data about violent crimes with the help of local law enforcement. Early on, this research was mostly focused on murders and suicides. After taking about a decade to understand violent behavior, the CDC was ready to address how violence could be prevented, since youth violence, particularly amongst inner-city gangs, was of particular importance at the time. In 1992, the CDC developed programming to reduce the amount of youth homicides, and by 1993, more general youth violence prevention programs were being implemented in schools and communities across the country. Here in Alaska, prevention began with the establishment of the Alaska Family Violence Prevention Project in 1993. The Alaska Family Violence Prevention Project has supported Alaskan healthcare providers and other service providers in their intentional injury prevention and intervention efforts through conducting research, developing training curricula, providing technical assistance and training, and maintaining a clearinghouse resource library which provides central statewide access to family violence educational and training resources. After much advocacy from domestic violence and sexual assault advocates, programs, and allies, a landmark in DVSA prevention occurred in 1994 with the passing of the Violence Against Women Act, or VAWA. This piece of legislation established the Office of Violence Against Women, appropriated over $1 billion to the investigation and prosecution of crimes against women, and established rape prevention and education programs nationwide. In the wake of VAWA, the CDC conducted the National Violence Against Women Survey, providing the first national data on the occurrence and prevalence of intimate partner and sexual violence, as well as stalking. Since the establishment of the Alaska Family Violence Prevention Project, primary prevention had slowly been gaining momentum. Communities were beginning to do prevention work, most often with youth, but most effort, staffing, and funding was put towards victim services prior to 2002. Prevention in Alaska gained more attention in the late 90s as a result of the 10-state health initiative, which helped to provide training and collaboration work with hospitals and clinics throughout Alaska and craft policies and procedures for healthcare providers and institutions when working with and screening victims of domestic violence. Then, in 2002, the CDC creates the Domestic Violence Prevention Enhancement and Leadership Through Alliances program, better known as DELTA. The DELTA program currently funds 14 domestic violence and sexual assault coalitions so that they can provide primary prevention training, technical assistance, and funding for local prevention programming that prevents first-time perpetration or victimization, reduces risk factors associated with intimate partner violence, promotes protective factors that reduce the likelihood of intimate partner violence, implements evidence-supported strategies incorporating behavior and social change theories, and evaluates prevention strategies and using results to form future plans. Since its inception, the DELTA program has allowed for the creation of programs that address multiple angles of intimate partner violence, such as those that address teen dating violence, healthy relationships, as well as those that prevent first-time male perpetration. Later in 2002, the DELTA project coordinator worked to form the Pathways Statewide Steering Committee, which brought together a diverse group of more than 20 partners from across the state of multiple disciplines that all had a stake in eliminating domestic violence in Alaska. Over several years, they worked together to develop a shared understanding of primary prevention and clarity around the conditions and factors that support violence in Alaska. That same year, Alaska became one of the 14 Delta states after the Alaska Network on Domestic Violence and Sexual Assault secures funding from the CDC. The framework from the 10-state health initiative provided the foundation for Alaska's Delta application. These funds made it possible for the network to create a new position devoted to coordinating Delta activities statewide, as well as providing an opportunity for communities around Alaska to receive funding for prevention activities locally. 4 prevention programs were awarded funding in the first year, including Dillingham, Juneau, Sitka, and Valdez. The next 5 years or so were devoted to understanding primary prevention. The network and its partners reviewed prevention strategies. This involved a lot of research on existing prevention strategies in other states, or for things like substance abuse, program evaluations, and capacity building. Meanwhile, the network was also working to support the 4 Delta communities by collaborating and training prevention staff at local victim service agencies. In 2006, planning began on the Rape Prevention and Education Plan. Completed in 2009, this plan utilizes primary prevention principles to prevent victimization and perpetration in Alaska specific to sexual assault. Because of the historical context of the time, the RPE plan was developed separately from the Pathways plan. However, its execution has largely been a collaborative process, with the RPE and Pathways plan complementing each other. After spending some quality time understanding how prevention works, the Statewide Steering Committee spent 2008 and 2009 drafting a primary prevention plan for Alaska. The plan outlined goals and outcomes for eliminating not only domestic violence, but sexual and teen dating violence through promoting healthy relationships and healthy sexuality. As a result of the plan, a number of prevention strategies were intentionally developed to work with the priorities established within, including Lead On for Peace and Equality, Stand Up Speak Up Alaska, When I Am an Elder, Coaching Boys into Men, Alaska Men Choose Respect, and the 4th R. During the time that statewide strategies were being developed and implemented, communities around Alaska began working on their own prevention plans. These local plans complement the statewide plan to provide more localized solutions. Currently, the communities of Ketchikan, Juneau, and Sitka all have plans devoted to domestic violence and sexual assault. In December of 2009, the Governor's Office committed to take significant strides to stop the epidemic of domestic violence, sexual assault, and child sexual abuse in Alaska. Governor Parnell's Choose Respect initiative fosters collaborations between the state government, nonprofits, and tribal organizations to work across the spectrum of violence. The initiative has been a significant source of prevention funding across the state, including the Division of Behavioral Health Domestic Violence and Sexual Assault Pilot Project, public awareness and prevention campaigns, and specific state and local prevention activities. The governor has also supported and initiated prevention marches in more than 160 communities across the state. And that brings us to the present. What happens next in the history of the primary prevention of domestic, sexual, and teen dating violence is up to us. Whether we build strong prevention coalitions, build organizational prevention capacity, establish strong community plans, design great prevention programs, change community norms, or influence policy, our work will change history and will make Alaska a healthier and safer place to live. To conclude this module, let's hear a personal account on the prevention movement from Vicki D'Amico, Executive Director of Sitkins Against Family Violence.
I have worked here since 1988, so almost 25 years. And in the beginning, we were a very small program. We were, just coming out of the women's movement, just starting the women's movement. And so we were providing basic shelter and awareness of the issues. We were, starting to build a reputation like any oppressed group, starting to make noise. We were battling systems for things like abuser accountability, recognizing predominant aggressor and DV incidents, mutual protective orders, system and societal victim blaming. But around my 20th year of doing direct services, I was seeing the young children who had stayed in the shelter in the beginning, now in their early 20s, fleeing to the shelter with their own babies for shelter after violence. And this was completely depressing to be direct witness to the next generation repeating the cycle. So after years of assisting and supporting victims with legal and medical, financial, housing, safety, we all tried to look at, how to stop the violence. That's what we were hearing from the women that we provided services to. So it took several years and some key people to be hired both in shelter and a statewide level to really get what I now understand is a movement. They were a handful of grassroots people who understood that societal change had to come from an intentional, well-planned, multi-layered, comprehensive, long-term movement. So they were doing this kind of on their own. The staff, who are so response and intervention-oriented, myself included, that we still didn't quite get it. And besides, the prevention people had their own lingo, which no one understood. It was, they had their own language. So when I became director last year, I had to really start paying attention and learning what prevention is. And even though I have a long way to go, I can see that this is the only thing that gives me hope so that the next generation won't be coming to shelter for services. To see how all the layers are planned so carefully to target key populations, to watch different agencies in the community buy in, to get to work with such a positive message instead of just, don't use violence. It's more subtle, it's more inviting, it's more diverse. It's going to take years. It's a movement, and it gives me great hope.
That wraps up our introduction to prevention. For more information on what you have just learned, please refer to the Module 2 section of the companion materials. Next up, we will be getting a little more in depth with primary prevention in Module 3, Primary Prevention Under the Hood.